I'm Dr. Christopher C, and welcome to this audio summary of me reading anatomy to you. In this video, we'll cover the sacral plexus, including the major nerves, the overall arrangement and their pathway, the nerve roots, their motor and their sensory function. The sacral plexus is formed from the nerve roots of S1 to S4, but it also receives a contribution from the lumbosacral trunk, that's L4 and L5. There are 5 major nerves of the sacral plexus: the superior gluteal, the inferior gluteal, the sciatic, the posterior cutaneous nerve of the thigh, and the pudendal. In addition, there are some individual muscular nerves, and finally, from the autonomic system, there's the pelvic splanchnics. Let's start with the overall arrangement. Really, the nerves of the sacral plexus come into 2 categories. Either they stay within the pelvis and innervate local structures, or they exit the pelvis via the greater sciatic foramen. Let's start with the first nerve, the superior gluteal nerve, from nerve roots L4, L5 and S1. This nerve exits the pelvis via the greater sciatic foramen and has the motor function to gluteus medius and gluteus minimus, as well as some to tensor fascia lata. It has no sensory function. And it's worth noting its superior name, superior gluteal, refers to its exit above the muscle piriformis inside that foramen. In fact, all the other nerves that exit from this plexus are below piriformis, and that makes the superior gluteal nerve rather easy to identify in a specimen. The second nerve of this plexus is the inferior gluteal nerve, from nerve roots L5, S1 and S2. It also exits the pelvis via the greater sciatic foramen and provides motor function to the large muscle gluteus maximus. There is no sensory function. The third nerve is a rather large nerve, the sciatic nerve, from nerve roots L4, L5, S1, S2 and S3. This also exits the pelvis via the greater sciatic foramen and provides motor function to the posterior thigh before dividing into 2 branches, the tibial and the common fibula. In the posterior thigh, it supplies biceps femoris, as well as semimembranosus and semitendinosus. The first of the 2 branches lower down is the tibial, and this provides motor supply to the posterior compartment of the leg, as well as some intrinsic foot muscles at the sole of the foot. In sensory supply is to the skin, to the posterolateral leg, and the sole of the foot. The second branch is the common fibula, sometimes called the common peroneal. This provides motor supply to the anterior and lateral compartments of the leg, as well as other intrinsic foot muscles. It provides sensory supply to the lateral leg and the dorsum of the foot. The fourth nerve is the posterior cutaneous nerve of the thigh, from nerve roots S1, S2 and S3. As you might have guessed, there's no motor function, but it does supply skin on the posterior thigh and leg, as well as the skin of the perineum. Now importantly, it gives off the inferior cluneal nerve from nerve roots S1 and S2, and that supplies the skin of the inferior and lateral buttock. It also gives off a perineal branch, which supplies the medial thigh as well as the posterior scrotum or posterior labia majora. The 5th and final major nerve is the pudendal nerve, arising from nerve roots S2, S3 and S4. Now this one has a rather special pathway, as it exits via the greater sciatic foramen, but it crosses the ischial spine and re-enters the pelvis via the lesser sciatic foramen. It then travels in the pudendal canal, which is actually in the fascia of obturator internus. It has 3 major branches: the inferior rectal, the perineal, and the dorsal nerve of the penis in males. The motor function is to the muscles of the perineum, including levator ani, the 2 external sphincters, the external anal sphincter and the external urethral sphincter. It also provides sensory to the majority of the skin of the perineum, as well as the penis and the clitoris. In addition to the 5 major nerves, the sacral plexus also gives off individual muscular branches. These include the nerve to levator ani from nerve root S4, the nerve to piriformis from S1 and S2, the nerve to quadratus femoris from L4, L5 and S1, and the nerve to obturator internus from L5, S1 and S2. Finally, we have the autonomic contribution, and this is via the pelvic splanchnics from nerve roots S2 and S3 with a contribution from S4. Starting with the visceral motor, this comes via the pelvic prevertebral plexus, and it stimulates erection, modulates mobility in the very lower GI tract, as well as inhibits the internal urethral sphincter. We also have sensory. This is the visceral afferents, and in this case it's from the pelvic viscera and the distal colon. Finally, a nearby and related structure, but not part of the sacral plexus, that is the coccygeal plexus, and this is formed from S5 as well as the coccygeal nerve 1 with a small contribution from S4. The main output of note is one nerve, that's the anococcygeal nerve, and this supplies sensory to the skin over the coccyx. That's all. Thank you and see you next time.